Are you gonna sit with me?
You know, I've been making vlogs for a little while. My girlfriend Emily's been in them a little bit. I might have mentioned that she's in medical school. I don't think I've talked a lot about it. It's kind of a big part of our lives. Once I started making videos, I knew that her talking about how she got in would be kind of cool, and how she did it would be pretty interesting to some people. It seems like there's not a lot of people out there making good quality videos about medical school and talking about real struggles. So who would you say this video would be for then, if you're talking about the personal statement?
I think specifically for pre-med students writing and getting ready to apply for their cycle, but also I think you have to write a personal statement for getting into any sort of graduate school and residency. So it's something that I have to be able to do again when I'm applying for residency too.
Okay, cool. Well then, I'm gonna jump out. I'm gonna let her talk to you guys about that. I hope you enjoy it.
So I thought we'd start talking about personal statements. This thing I felt like felt so important, and everyone you talk to, all your advisors say personal statement is the way you can shine outside of all of the marking the boxes that you do in school and with your volunteering and your clinical experience and research and all those things. I thought that, this was the thing that was going to get me into an interview, because I wasn't like a student that someone was going to look at my application, invite me in October for an interview, and I felt like you don't get a lot of space. You have everyone telling you this is like the most important part of your application, and I have to tell you, I wrote 2 different versions, and the first one I felt like really captured who I was and why I was going to school, and it came down to where my advisor really thought that it wasn't the right message. It made it sound like I was wavering on my decision. So it made it seem like I was wavering on my decision. And the second one was the one I went with. So just because my advisor said that it was really explained how passionate I was about taking care of patients. So what I did was really beneficial, was just start writing and brainstorming and basically just stream of conscious what makes me think I want to be a doctor. And if you don't feel like you have an answer coming into the cycle, I totally relate. I feel like I just knew that was what I was supposed to be doing, and I promise you, if that's the way you feel, you get into medical school and it just, everything clicks. It makes it like it's the most rewarding, fulfilling experience to come in and be like, this is exactly what I thought I would be doing. This is perfect. And people that were close to me, thought it was a great personal statement. It wasn't unprofessional. It didn't seem like I wasn't sure about going into medicine, and they felt like they really got to know me through my essay. But when I brought it into my advisor, she kind of said, this isn't what they're looking for. And so it kind of overwhelmed me, because I felt like I had poured my heart out into this and really answered the question, why do I want to be a doctor? And why is it important to me? So I had to go back and kind of think about all the strategies that people use to make an interesting statement. So first I thought, okay, so I have to open with a clinical vignette. Everyone loves vignettes. When you read the paper, it gets a little more interesting, because it's like, how do you start out saying, do you just say I want to be a doctor because, no, we can't do that. So I wrote about a patient experience I had in the emergency department at a children's hospital, which is where I work still, and it was really powerful for me, because going into it, it was terrifying to think I'm going to be around children that are really sick and or maybe dying. And so writing about a patient experience I had there kind of started the ball rolling. And then I went into pretty organized. It felt a little fake to me, but organized, saying these are several other experiences I've had in my volunteering or my clinical experiences that prove different points about why I'm going to be a good doctor. And so the framework really laid out is you have to determine how am I going to catch interest with somebody, what are the points that I want to make about myself, and what real life examples do I have to make those points. And that's how you should think about your essay, no matter what you're talking about. You have to have something interesting to grab people's attention. It doesn't have to be crazy. And it has to be you. You can't just make up something, And then come up with 3 points that emphasize why you should be there, that maybe you haven't covered in the rest of your application. And then think of examples that you can actually prove those points about you. And all the while, it really needs to be focused on what you're going to be bringing to patients and what you're going to be bringing to healthcare and the future of medicine, because that's what they're looking for. They're looking for the people that are going to be a part of their colleagues. It's like a part of the rest of the profession in 4 years. So really what I'm trying to say was, like, you may feel frustrated and terrified and like, if you mess this up, there's no way you're going to be a doctor. And that's not true. What they're really trying to get you to do is show off how great you are. And I think with, the outline that I gave you, where you're just basically trying to prove it by example, you can really make something that is polished, professional, fits the expectations, fits the word limit, but also kind of gives people a little bit about you and makes them want to invite you to an interview and talk to you more about it. But thank you guys. That was one of the harder aspects of applying, but you're gonna do great. It's gonna be fine, and really just follow the pattern, and I feel like you'll be set. Okay, great.
All right, guys. So I hope you like that. I don't know. We'll probably do a few of those. What do you think, babe? You like doing that?
Yeah, I liked it.
Yeah, we'll probably do a few more. I think it's a good way to get people into my channel and see some of my other stuff. Also a good way to get people to, hey Mo, know my girlfriend a little bit better, because she's in the videos quite a bit. I think that going to medical school can be pretty daunting and stressful. So I think that having somebody out there putting out good content about their experiences can be helpful. I hope you guys liked it. If you did, like and subscribe. Watch some of my other stuff. I'll link my other videos below. I usually just do daily vlogs, stuff like that. You can see my puppy dog Momo, and a little bit more of my girlfriend. But yeah.
There goes a sight from my soul.